All right, Dr. Rucker here with Nurse Kelly. We're going to have a fun one. I pulled up some information, but prior to starting the recording, Kelly wanted me to address a question, which is how did I evolve into this field of integrative healthcare? And I trained at medical school at the University of Virginia, and then I went to perform general surgery and urologic oncology training at Sloan Kettering and Cornell in New York City. And then I was a urologic oncologist for 12 years, and I shifted into doing all kinds of integrated medical projects and tasks. For instance, when I was doing partial nephrectomies, I would take out a piece of the kidney and I would use a bed of stem cell matrix because I discovered this could help with wound healing, sealing the areas that could leak with urine, and even diminish bleeding. So that was one example how I started using stem cells and biological products, and I had the opportunity to start working with a professional center that treated athletes. They thought, because of my background and my open-minded approach, that I would be perfect to treat these professional athletes who were trying to recover quickly, recover from injuries quickly, things like that. And that's what happened. I just made this foray into integrative medicine. It's not like I unlearned becoming a urologic surgeon, but I added a lot of things to it. And I believe, to me, that was a nice segue into methylene blue, because I have a nice little article we're going to use as reference on methylene blue. But the key thing I want to point out is this is a product that was used in conventional medicine. As a urologic surgeon, I would reconstruct bladders, and sometimes the ureter, which is the tube that carries urine from the kidney, was difficult to distinguish, or was difficult to distinguish a leak. And we would have the anesthesiologist inject a lot of methylene blue into the patient. So it kind of shows you how safe it was. I thought, wow, this is neat. This is something I'm already familiar with. And
hasn't it been around like since 1940 or something like that? I mean,
yeah, I think, okay, this article's pretty cool.
I think
MB has a colorful history. It was initially developed in the late 1800s as a dye for textile. Fun fact, it was used to make jeans blue. Then it was seen that it could help with treatment of malaria, and it has antifungal, antiviral, antibacterial properties. It became available in the 1950s as a fish tank cleaner.
That's kind of gross.
Yeah. Then it was discovered to have antipsychotic and mood-enhancing properties, and a lot of neuroprotective. So this doctor's written a nice little article that I am going to use as a template.
Okay.
There are a lot of different things that help as an electron cycler. It helps with mitochondrial energy. It readily crosses the blood-brain barrier.
Isn't that what every cell in the body actually needs to work, is mitochondrial energy?
Yeah, absolutely. The cells require their little powerhouses of energy. I believe as we're able to learn more about medicine, we're going to find that a lot of disruption in the body is due to the mitochondria not functioning properly. Chronic fatigue, MS, you name it, all kinds of things. And then if your mitochondria make you perceive a state of low energy, it's going to lead to depression. And even here they're talking about mood enhancing. Maybe some of the psychoses and psychological problems we're going to find out that they're mitochondrial in nature. I'm obviously speculating, but the reason we're making this video is methylene blue fits in a unique category because it's not a peptide. I call it a exotic supplement because of its background and history. Incredibly safe. I believe in an upcoming video, Kelly and I will take a nice dose of it. We did this last week. Kelly's used it a lot more than me. I've used it a lot more on patients. I can tell you this, it's very safe to use orally and by intravenous route.
And it works right away.
So we're gonna test it. I did try it. It made my teeth and tongue very blue. It gives you the Smurf thing. Let's look at some other things. I'm gonna just quick fire through here. Electrons, cytochrome, oxidase, that has to do with ATP production. Glucose metabolism, it's helping there. Red blood cells, it changes the configuration of iron. It's a powerful antioxidant and antidepressant.
So what is its mechanism of action? If it's doing all of this, is it going in directly affecting those mitochondrial
Now, that is a good question. I don't know what its exact mechanism is. I believe they're saying here it acts as an electron cycler, so it donates and accepts electrons.
Okay, and you need electrons within the cell.
Yeah, so it's funny, 'cause since I grew up as a surgeon using it for a specific purpose, I didn't really deeply study the exact mechanism because it's a simple compound.
Yeah.
I guess it's that simple. It's donating and accepting electrons. It has a unique, so it's almost like a buffer and a handoff agent. And I don't think, sometimes in medicine will you be able to delineate each thing. How can something be electron transport helper, antidepressant, a glucose stimulator, a red blood cell stimulator, all these different things? Sometimes we don't know the answer to every question. But it obviously has multiple uses and the safety profile is incredible.
It should be in the water.
Probably
It
not
should be,
fluoride,
right?
but methylene blue. I totally agree with it.
Well, I say we give it a shot.
Well, yeah, so I know that many integrated practices are offering this, and we are going to have our own offering at our shop at reversepractices.com. And I wanted to make an intro video on how safe it was and quite potentially extremely effective. So we're going to have to learn from our patients. We take great ideas, our patients start with them, and then we start following them, and the ones we keep using are the ones that flourish. I would suggest that is the capacity to have empiric observation. We're not clouded by fake data, such as the statin data and things like that, or even some of the chemotherapy data that's faked and allows big companies to make money. So that's the difference on how I've always operated and worked on patients, and now Kelly's partnering with me on our peptide program, our female program, and some of these exotic offerings. So thanks for taking a listen.
Thanks.